The KJLH 20th Annual Women's Health Expo at KJLHradio.com. Presented virtually by RastAfri and Radio Free, KJLH.
Hello, everybody. This is Auntie Maxine, and I'm so pleased to welcome you to KJLH's 20th Annual Women's Health Expo. Let's get started. First of all, I want to thank Stevie Wonder, who has owned KJLH since he purchased it in 1979. And we're so appreciative for this radio station. And of course, there's Karen Slade, Vice President and General Manager of KJLH, for her phenomenal leadership at our community's radio station. But I want to tell you, I have been with this Women's Health Expo since it was first started. And I'd like to thank and remember Jackie Stevens, the former news director and founder of the Women's Health Program. And of course, Loretta Roberts, now director of the Women's Health Expo. And of course, all of the KJLA staff and my friend Dominique DePrima, who usually has her own forum that goes on here during the Expo. But you're all so wonderful. You work so hard and you have involved so many people in putting this event together. So I want to thank you always for inviting me to participate in the last 19 Expos. Before I begin, let me just say a few words about my friend John Lewis, who passed. John Lewis, the icon. John Lewis, the civil rights leader. Some have referred to him as a saint. As a matter of fact, it was a historian recently who called him a saint, reminded us that he was not perfect, but he was better than most of us. This leader, this civil rights leader who sacrificed so much, started out from the time he was 17 years old, understanding what racism and discrimination was all about. And, coming from, where he came from, he not only understood it, but he lived it. His daddy was a sharecropper, on and on and on. He got into the idea of doing something about it and hooked up with Rosa Parks first and then Dr. Martin Luther King. And at 23 years old, he was there on the big stage at the Great March on Washington with Martin Luther King and all of the heavyweights of the civil rights movement, sharing his thoughts about what he had done and what could be done. I can't tell you how important it is each year for all of us who remembers what it was all about to go to Selma, Alabama and march across the Edmund Pettus Bridge with John and so many other people who participated for so many years in fighting for our voting rights and fighting for civil rights. And so I certainly make sure that my calendar is clear to do that. But working with John here in Congress is an absolute historical importance to me and to everybody. When John speaks, the place gets quiet because they know that when John takes the floor, he's got something important to say. And he's forever reminding us that if you fight, you can win. But if you don't fight, not only will you lose, but you will not know what you could have done if you had only chosen to fight. He talks about getting into trouble. He talked about it all the time. He called it good trouble. And so I could go on and on about John Lewis. He was a man of peace. He just loved everybody. I was in awe of him because he did not have a revengeful bone in his body. He forgave those who beat him, who cracked his skull as he crossed the Edmund Pettus Bridge. He even took a delegation to go and meet with George Wallace, who was the greatest racist of all time. And so we must remember him. And it's being done in a way that really does him justice. The news media has been so kind and so thoughtful in the way that they have celebrated his life and his times. And so we're here today at this Women's Expo being put on by KJLH, and I want us to remember as we seek out ways by which to be more healthy and to take care of ourselves. It's all about being fit for the fight. And that's what John was all about. And so here we are. And this has been one of the most well-attended events for women in the greater Los Angeles County area. As a matter of fact, women come from all of the adjacent counties. This has been going on since it was founded 20 years ago. And of course, again, I'm very proud to have attended every year since then. And so the founders of this expo knew that women not only wanted information about their health and connections with healthcare providers, but they would also be able to take control of their health and the health of their families if they were better educated about how to deal with all of these health issues. One thing that these women knew, and the women who have always come have always known, is that we have had these pre-existing conditions because we have not had access to healthcare. And so when they talk about, Black people and Black women with diabetes and with heart problems and with cancer, and, Black women dying from breast cancer because we did not have access to healthcare and could get to a doctor to have our examinations early and to have our yearly examinations. We were dying, when we could have lived, but dying because we were dying because of we did not know about preventable efforts to take care of ourselves oftentimes. And so here we are in the middle of this big pandemic, COVID-19. What a better time to talk about healthcare. What a better time to talk about what we're going through and what we can do to protect ourselves. As you know, the COVID-19 pandemic is a tragic of unprecedented crisis. There have been more than 4 million confirmed COVID-19 cases in the United States, and more than 600,000 people have died. The US has far more cases and deaths than any other country in the world. Brazil is a distant second with 2.3 million confirmed cases, more than 86,000 deaths. The US had more than 50,000 new cases in one day for the first time on July the 1st, and several states are experiencing surge in cases, especially Texas, Florida, and of course, our own California. Our home state of California has more than 445,000 cases and 8,300 deaths. Los Angeles County alone has more than 169,000 cases and 4,300 deaths. And so here we are. Like so many other diseases, this COVID-19 is having a severe and disproportionate effect on people of color. The New York Times obtained new federal data from the Centers for Disease Control and Prevention, that is CDC, that allowed a comprehensive analysis of COVID-19 racial disparities. The data shows that Blacks and Latinos have been disproportionately affected by COVID-19 across the United States in urban, suburban, and rural areas, and across all age groups. Blacks and Latinos have been 3 times as likely to become infected as whites. Blacks and Latinos have been nearly twice as whites and likely to die from the virus, and this is well known now. One of the main reasons that African Americans and Latinos have been so severely impacted by coronavirus is that we are already disproportionately impacted by pre-existing conditions that cause people to be at high risk for a severe case of COVID-19. These conditions include diabetes, cancer, chronic kidney disease, chronic obstructive pulmonary disease, obesity, serious heart conditions, and sickle cell disease. The fact that we are more likely to have these pre-existing conditions makes it all more important that we oppose the Trump administration's heartless efforts to undermine Obamacare and take health care away from people with pre-existing conditions. African Americans and Latinos are also more likely than whites to be exposed to COVID-19. This is because we're more likely to have frontline jobs that prevent us from working at home. We're also more likely to rely on public transportation and live in more cramped apartments or multi-generational homes. Our higher risk for COVID-19 makes it all the more important that we do everything that we can protect ourselves and our families and our communities from this terrible virus. We must also do everything that we can to protect our health care and demand justice for our nation's leaders, from our nation's leaders. And so, my colleagues and I in Congress are also doing everything we can to address this unprecedented crisis. We began by passing an $8.3 billion emergency funding bill in early March. This bill was the first step and provided public health funding for prevention and preparedness and financial support for small business owners. Second, we passed the Families First Coronavirus Response Act to help families by expanding coronavirus testing, strengthening food security programs like food stamps, that is SNAP, for children and seniors, and providing enhanced unemployment insurance and paid sick leave for workers. On March the 27th, we passed the historic CARES Act. This was the $2 trillion economic security package, the largest in our nation's history, and it includes several provisions that I drafted as the chair of the House Financial Services Committee, and a broad range of initiatives that provide some benefit to essential workers, including a temporary moratorium on eviction filings, foreclosures, and mortgage payment forbearance. For those with student loans, the CARES Act passed and paused payments and suspended debt collection, prohibited wage garnishment, tax seizures, and benefit reductions, and paused interest accrual on most federal student loans. The CARES Act also dramatically expanded unemployment benefits, and it provided immediate direct cash payments of $1,200 for each adult and $500 for each child. It included $150 billion to help states and local governments cope with the pandemic and $200 billion for health programs. And on April 23rd, the House passed the Paycheck Protection Program and Healthcare Enhancement Act, which provided $370 billion in funding for small businesses, along with much needed reforms to the Paycheck Protection Program, that is the PPP, for small businesses, as well as $100 billion for hospitals and coronavirus testing. Finally, the House Democrats passed what is known as the HEROES Act, a comprehensive bill to address the unmet economic and health needs created by this pandemic. The legislation directs nearly $1 trillion to state, local, and tribal governments. It also adds $2 billion in pandemic hazard pay for essential workers and $75 billion for coronavirus testing, contact tracing, and treatment efforts. This bill must pass the Senate before it becomes a law. So what's happening with this bill that should have been passed? Well, it's the Senate. They're holding us up. In addition to passing legislation to combat the pandemic and channel financial support to struggling Americans, congressional Democrats are engaged in ongoing and thorough oversight of the Trump administration's use of the trillions of taxpayer dollars entrusted to it. So as chairwoman of the Financial Services Committee, I'm committed to ensuring that federal financing and housing regulators use taxpayer dollars to support the most vulnerable Americans, including communities of color, people with little or no income, and frontline workers. I serve also as a member of the Select Subcommittee on the Coronavirus Crisis. In this role, I've called the Trump administration officials to account for the executive branch's failure to develop a comprehensive and coordinated plan for addressing the nation's public health needs during this pandemic. So what can we all do? While the Congress is doing what we can to address this crisis, each and every one of you must do what you can as well. We must all practice social distancing. We must all wear face masks when we go out into the public. We must all wash our hands frequently and use soap and water for at least 20 minutes or use a legitimate hand sanitizer. We must all stay home when we're sick. We must all take care of one another and protect one another. We must demand action from our public officials. We must demand that the Senate stop holding up the HEROES bill and pass this bill so that we can get it on the president's desk to sign so we can help our nation confront the challenges we face. And of course, we must not and cannot forget to register and vote so that our country will have leaders who care more about protecting public health than protecting Confederate statues. This virus is not going away anytime soon. So let's all confront it with the urgency it deserves. Ladies and gentlemen, I must tell you that the President of the United States has been derelict in his duties. He has defaulted rather, as a leader. He doesn't have a comprehensive plan. He intercepted PPE, that is the protective equipment that nurses and doctors and hospitals need. And he was competing with governors and sending PPE to the red states where governors who are Republicans were getting the equipment and so-called blue states were not. This is not a partisan issue. Everyone is affected by this issue. And so this president started out by saying, oh, this is a hoax. And then he said, it's going to disappear. And then he said, oh, you should be drinking or taking disinfectants to deal with it. And of course, he has been in denial. He has basically denied what our health experts have been telling us about this virus, what to do and what to expect. And so we can't depend on him, but he has defined himself throughout this administration. And we know that we can't depend on him. Our job is to get rid of him and get him out of office. Our job is to elect someone who is responsible, who cares about the Constitution of the United States of America, and who believes in supporting this democracy, rather than getting in bed with the Russians and Putin in the way that this president has done. And so we have our work cut out for us. Yes, this is trying times, but the history of our people tells us that we have always been able to face trying times with hope and with great expectations that we could do better. And so that's what we must do now. We must have hope and great expectations every morning when we get up. Start all over again. Do what we can to protect ourselves and our family, but understand that the future of this nation depends on the democracy being strong and the Constitution being respected, and electing individuals at the highest level of government who will respect that Constitution and who will do everything that they can to strengthen our democracy. And we're just not interested in the top of the ballot. We've got to go down that ballot and elect to our United States Senate and to the House of Representatives and to the state legislators, the state senates, the House Assembly in the state of California, and all of the local elections that are on the ballot. Don't stop at the top, because much of what happens in your communities depends on state and local elected officials. We're looking at this problem that we have with education. There's no real instructions and real education and real caring coming from the President of the United States in this administration. And so it is your state legislators and your local elected officials who are making decisions about whether or not we're going to open up these schools, whether or not it's safe, or whether or not we understand how to do, the kind of social distancing with children and whether or not children will wear masks, and whether or not we can have a safe environment for them. And so it is so important to vote down ballot, the entire ballot. You know, every time we have these health expos, you give me the opportunity to share with you my thoughts about what's going on politically. And I don't hesitate to do so. I don't hesitate to do so because that is why you send me as your representative to the Congress of the United States of America. And I'm reminded of that every day. Every day when I awaken understanding not only what I care about, what I'm willing to fight about, but what you expect of me. And so if the latest video that you have seen that went viral, you know, on the Twitter, and I guess it was on Facebook and everywhere, you saw me as I was watching what the sheriff's deputies were doing when they stopped a brother and started to undress him, take off his shirt and his jacket and his shoes and all. And as people were passing by, they called to say, hey, Maxine, what's happening over there? I explained to them what was going on. Some of them stopped and they came over with us, but I consider that accepting responsibility also with the killing of so many Blacks and so many unarmed Black men in this country. We've got to be about police reform. We've got to make sure that we have people who we pay to protect and serve us do just that, rather than shooting and killing and beating and abusing and targeting. And so I'm about not only coming to the Congress of the United States and debating the issues and creating legislation and trying to get legislation passed, getting these amendments going, and helping to educate people about what is needed in our communities. I'm about not only healthcare, police reform, and education, and all of those issues that are part of what makes this country what it is and what makes this country what it's supposed to be. So again, I want to thank you so much for having me every year. I will be with you, whether it is the way that we're doing it now, because we cannot gather in large numbers, but it does not matter. I will be with you, whether it is virtual or whether it is in person, every year, because I respect and appreciate so much what KJLH is doing for us and for women. Thank you and goodbye.
The KJLH 20th Annual Women's Health Expo at KJLHradio.com. Presented virtually by RastAfri and Radio Free. KJLH.